Mr. Senior?
Yes.
Hey, my name is Brittany. I'm going to be your nurse today. We are going to be doing your physical assessment today. Is that okay to do?
Yes.
Okay, can you verify your name and date of birth?
Matthew Senior, date of birth is 01/25/1989.
Can I check that on your armband? And is it okay to touch you?
Yes.
Okay, alrighty. And then I have the doctor's orders today that we are going to do the physical assessment. I'm going to perform hand hygiene and I'm going to give you some privacy, okay? Alrighty. And how are you doing today? Do you know where you're at?
Yes.
Okay, where are you?
At the doctor's office
Okay, why are you here today?
for a physical.
Okay, and do you know what month it is?
September.
And do you know who the president is?
Yes. Joe Biden.
Okay, it looks like the patient has good grooming, good dress, no physical deformities that I can see. Consciousness and orientation was good. Mr. Senior, do you mind removing your hat? Okay, skin color looks normal for the patient. His eyes look symmetrical, so do his ears. The nose looks symmetrical in the middle of the face. Okay. Speech was good, seeing that the patient can hear okay. Do you have any hearing concerns today or vision concerns?
No.
Okay. We have not done skin, hair, and nails yet, so I'm actually going to skip those this time. Okay. The face I said was symmetrical. The head looks like it is good with symmetry. Are you having any headaches lately?
No.
Okay. And ears look symmetrical with the eyes and the rest of the head and body. Are you having any earaches today or ear pains or ringing in the ears?
No.
Any other issues with your ears?
No.
Okay. While I am here, I'm going to go ahead and look in your ears. Is that okay to do?
Yes.
Can you turn your head for me? I do not see anything, any mucus in the ears. I do not see any perforation in the ears. Ear color inside the canal looks normal. Alrighty, I'm going to do the Perla on your eyes. It's just I'm just looking, assessing for your pupil response. Is that okay to do?
Yes.
Alright, so you're gonna look at that TV in front of you, and then when I say okay, you're gonna look at this pen light, okay?
Okay.
So look straight ahead, okay? Okay, pupil response was normal and symmetrical. Now, if you'll just look straight at TV again, I'm gonna assess for pupil dilation. Okay, both pupils dilated to about a 2. Pupils look about a 3 right now in millimeters. Are you having any eye pain, issues with your vision?
No.
Do you wear contact lenses?
Yes.
Okay, I'll make a note of that. Nose looks symmetrical with the rest of the body. Do you mind if I take a look inside your nose?
No.
No drainage or mucus or discoloration noted. Are you having any nose issues like pain, inflammation, sinus drainage?
No.
Any sinus pressure?
No.
Have you ever had any nasal or nose surgeries or a deviated septum?
No.
Okay. Alrighty. If you don't mind turning your head that way, I'm going to assess for jugular vein distension. And if you look this way again, no JVD noted. Alrighty. If you don't mind, we'll look inside your mouth. You'll say ah. Oral mucosa looks normal for the patient. It is a pinkish color. No sores noted. Are you having any issues with your neck pain? Are you having issues with neck pain?
No.
Any issues with sore throat, nasal drainage, anything like that?
No.
Okay. All right. We have already assessed neurological. We did his consciousness and orientation. The Glasgow Coma Scale is to make sure that you are aware of where you are, to make sure you've not had a head injury. So we've already evaluated that. Okay, I'm going to go ahead and do your respiratory system. I'm going to touch you with this. Every time I touch you with different spots, I want you to breathe deep, inhale and exhale, okay?
Alright.
I'm going to start with the front. You sit back and relax. Breathe through your nose. Okay, I'm going to do your back now. Every time I touch you, breathe deep through your nose, out through your nose. Can I lift up your shirt?
Yes.
Just in the back. Okay. Alrighty. Let's see, I'm going to palpate some pulses. The ones I'm not going to do is your femoral artery, and that is right here. I'm not going to do your carotid, which is right here, and we never palpate both those at the same time because it can cause the patient to pass out. Your brachial artery is here. I'm not going to do that today, but I am going to do your radial, okay? Okay, that will be 2 plus left arm, 2 plus right arm. I'm going to do your dorsalis pedis. I believe that's what it's called. 1 plus, 1 plus, and your posterior tib, 2 plus, 2 plus, okay. Alrighty, and then normally if you do come into the doctor's office and you have any respiratory issues, I would advise you to do the turn and cough. So what you do is take a deep breath for me, hold it for a little bit, and you're going to cough and turn your head. Okay, and then I would also advise you to use a incentive spirometer 10 times every hour, okay? Are you having any issues with your respiratory system, like breathing, any pain in your lungs?
No.
Okay, all right, perfect. Okay, we have already done the JVD. I noted no distension there. We have palpated everything we needed to. We have, we also have one more site. The auxiliary will be right up under the armpit right here. Okay, now I'm going to listen to your heart. Is that okay?
Yes.
Okay. We're going to start over here with the aortic. Pulmonic. Erb's point. Tricuspid. And the mitral. And I'm also going to listen for any sounds of S3, S4. No S3, S4 noted. Everything sounded normal. Okay, are you having any heart issues?
No.
Do you have a history of high blood pressure?
No. Some.
Okay, and you're going to the doctor for that, checking up on that. Do you know how to check yourself at home?
Yes.
Are you on any medications for high blood pressure?
Not at the moment.
Do you have a history of high blood pressure in your family?
Yes.
Alrighty, okay, so we have done cardiac. So now I'm going to do the gastrointestinal. So I'm not going to lift up the patient's shirt today. I might do it underneath the shirt, but we won't lift up his shirt for the sake of the video. Are you having any issues abdominally, like any cramping, any issues with your bowel movements, any diarrhea, anything like that?
No.
When was your last bowel movement?
Today.
Okay, and are you normal? Is it
Yes.
Okay, alrighty. Okay, so I'm not going to palpate first because that might mess up my auscultation of the GI. So I'm going to listen first. Okay, I'm going to start in the lower left quadrant. I'm going to go in the upper left, going clockwise. I'm going to go in the, lower right, upper left. And we're going to go into the lower left. Okay. That did sound like everything was normal. And I'm also going to check for any whooshing sounds, which would be blood. So we're going to listen to your abdominal aorta. No brute sounds noted. I'm going to palpate. Is that okay?
Yes.
Okay. Do you mind laying a little flatter for me? For the sake of the video, I'm not going to lift up the patient's shirt, but I would check for symmetry in the umbilicus, symmetry on the stomach, and then any distension. No distension notice, umbilicus. I cannot remember the medical term, but he is an innie, not an outie. And I'm going to palpate. Okay, no distension noted. Okay, we already asked you a subjective question. All right, if you don't mind sitting back up for me. We are going to do some range of motion exercises. So what I'm going to do is place my non-dominant hand, which would be my left, on top of the patient's knee. I'm going to have the patient extend and flex. So I want you to pull your knee back for me. Okay, and then I want you to extend it. Okay, and then I'm going to do this side as well. Mild crepitus noted in the patient's right knee. And then I'm also going to do it on, let's do it right here. Okay, so you're going to flex, and then you're going to extend, okay? Do that again. Crepitus noted on the left ankle, okay? No crepitus noted, okay? I'm going to do let's do your elbow. Okay, so you're going to flex. You'll pull it palm out and pull it straight. Extend. Okay, no crepitus noted. No crepitus noted. And I'm going to do that pop. Okay, just a pop on that one. Okay, let's see. All right, and you're going to flex back, extend. And that's hyperextension. So extend and hyperextend. Okay. Mild crepitus noted. I have some early arthritis here. No crepitus noted. Are you having any joint issues today, Mr. Senior?
It sounds like it.
You have issues with your knees?
Yes.
From football?
Yes.
Okay. Alrighty. Do you have any pain today?
No.
Alright, I don't see the pain scale on here, but I'm gonna ask you. Pain scale of 1 to 10.
0.
Alright. Okay, Mr. Senior, I think that is all for today. Let me double check the doctor's orders. I apologize, we forgot one thing. I'm going to assess you for capillary refill in your fingers and your toes, okay? Do you mind bending your knee? Putting it all the way down. This one. Capillary refill is under 1 second, bilaterally. Capillary refill is under 1 second bilaterally. I'm going to check you for an edema. No edema noted, bilaterally upper arms. Just upper extremities. No edema noted lower extremities. Let me just double check my notes again. Okay, and we appreciate you, Mr. Senior. The doctor will be in right in a minute, okay?
Thank
You have
you.
a good day.
Thank you.